Welcome to session 8 in the Acceptance and Commitment Therapy series, whether you believe it or not. In this session, I would like to summarize the whole presentation into 6 core processes in ACT called the Hexaflex. And if time permits, just to touch on the technical aspects of therapy like case conceptualization as well. So before we go into the Hexaflex, just wanted to talk about goal setting in ACT. And we have heard this many times before, the acronym SMART goals, where S stands for specific, M stands for meaningful, A stands for adaptive, R for realistic, and T for time-bound. In ACT, the focus is on meaningful, which is guided by your values, as opposed to following a rigid rule or trying to please others or trying to avoid some pain. Adaptive stands for, is it likely to improve the quality of your life? The willingness and action plan. So you can write this plan down. My goal is to be. My goal is to, and then be specific as you can. The values underlying my goal are, the actions I will take to achieve that goal are, the thoughts, memories, feelings, sensations, urges I'm willing to make room for in order to achieve this goal. So remember, this is about acceptance, which is the opposite of avoidance. It would be useful to remind myself that the smallest, easiest step I can begin with is the time, day, and date that I will take that first step is. I would highly recommend watching the ACT matrix, which is a nice, neat summary of all the 6 core processes in ACT that we already covered. And the YouTube channel is called the Zen Social Worker. So contact the Hexaflex. This is the Hexaflex. This is what it looks like, the Hexaflex. So all the essential components of ACT are given here, which obviously help you to be more psychologically flexible. So acceptance, which is basically dropping the resistance to distress, or willingness. So acceptance is the opposite of avoidance in ACT, not the usual usage. I mean, the word acceptance is used in a different way in the normal usage, but in ACT, we use it as the opposite of avoidance, and which is the same as willingness. So acceptance and willingness are the same. Diffusion is stepping back from our thoughts or unhooking from our thoughts. Self as context is understanding that you are not your thoughts or feelings, that you have an identity that is separate from your thoughts and feelings, and therefore you have the power to be in control rather than let them control you. Which doesn't mean that we try to control our thoughts or get rid of them, but we try to move towards our values in spite of our distress or thoughts or feelings. Contact with the present moment is about mindfulness. So using your sense organs to connect with the present moment in whatever task you're doing. Values is about trying to understand, what does my life stand for in the big picture? What do I want my life to stand for in the big picture of life? Ultimately, what is it that matters to me? What is it that value? What is it that I deeply value, which can give me direction or motivation in my life? Committed action is to take or make goals based on your values, which we already discussed in the value action, willingness and action plan, where we say that I'm going to make room for these feelings, sensations, urges, which basically stands for distress. I'm willing to make room for them because I value going in this particular direction. That's what I value. ACT, initial case conceptualization in ACT. So first we need to get the client to describe their own problem and what does he or she want from therapy. So after we've done that, the next step is to reformulate that presenting problem. So if the client says, I want to eliminate anxiety, you might reformulate that problem in other ways. So instead of eliminating anxiety so that I can start to live, which is the client's view of the problem, you reformulate the problem in other ways. Not getting on about the business of living while needlessly warring with anxiety. So you're needlessly battling with anxiety and therefore you're not able to live your life. What core thoughts, emotions, memories, sensations, scenarios is the client unwilling to experience? So they are avoiding. What kind of thoughts, emotions, memories? What does the client do to avoid these experiences? Overt behavioral avoidance, internal and external emotional control strategies, in-session avoidance or emotional control patterns. So the overt avoidance can look like activities, situations, people the client has stopped doing or avoids explicitly. Internal and external emotional control strategies may look like distraction, self-instruction, dissociation, drugs, self-harm. In-session or emotional control patterns can look like topic changes, argumentativeness, dropout risk. Relevant motivational factors. What is the cost of this behavior in terms of daily living, client's experience of unworkability, clarity of values, and therapeutic relationship? Environmental barriers to change, example, negative contingencies like a disability, unsupportive home or social environment, unchangeable circumstances, financial circumstances, costs of changing, or social losses. Factors contributing to psychological inflexibility examples might be excessive rule governance, being right, reason giver, self issues, lack of a sense of unable to describe feelings or wants, extremely low tolerance of emotional experiences, lack of present moment awareness, super logical, figures things out, excessive attachment to conceptualize self. Given the above, what parts of ACT may need to be emphasized in treatment? Client strengths. Sorry, that's a different step. So after you've done that, we'll say client strengths. You will mention that and then initial ACT treatment plan. So initial ACT treatment plan is made based on all of this. So contact with present moment. What are the areas that they are trying to avoid? So diffusion instead of the things that they are fusing with, what are the thoughts that they are fusing with? So basically you can use the same Hexaflex to make your treatment plan. So that brings us to the end of session 8. Thank you.